A 45-year-old man is admitted to the hospital with severe pain in his nasal cavity. Radiographic examination reveals a carcinoma. In which of the following locations would the carcinoma block the hiatus of the maxillary sinus? This requires knowledge of the anatomy of the lateral wall of the nose. In the lateral wall of the nose, there are three nasal conchae or turbinate bones. The three conchae project as shelves with increasing prominence from above down. Beneath the free border of each concha is a meatus, that's to say a passage. So we have a superior, middle, and inferior meatus, respectively. Above the superior concha is the sphenoethmoidal recess. A single opening exists in this recess, in the superior meatus and in the inferior meatus. The middle meatus receives all the other openings into the lateral wall. For this question, we need to know which opening is present in each meatus, in the sphenoethmoidal recess, and in the nasopharynx, to come up with the location of the carcinoma that blocks the hiatus of the maxillary sinus. So let's deal with the sphenoethmoidal recess. As I said, it lies above the superior concha, and it receives the opening of the sphenoidal air sinus. The sphenoidal air sinus, which is located in the body of the sphenoid bone, and the opening is present in the narrow roof rather than in the lateral wall of the nose. So carcinoma present here would block the sphenoid sinus, but not the maxillary sinus. In the nasopharynx, which is located actually behind the nose and not on the nose, the opening present there is the opening of the auditory tube or the eustachian tube, and not the maxillary sinus. The inferior meatus receives the opening of the nasolacrimal duct. The superior meatus receives the opening of the posterior ethmoidal air cells. So as you can see here that in the sphenoethmoidal recess, in the superior meatus and in the inferior meatus, there is only one opening, and in all these cases it is not the maxillary sinus. The opening of the maxillary sinus is located in the middle meatus, and this is not the only opening in this meatus. The middle meatus has a convex bulge beneath the concha. This is the bulla of the ethmoid bone, bulla ethmoidalis, and it's produced by the bulging middle ethmoidal air cells whose ostium opens on the bulla. Remember that the posterior ethmoidal air cells, they open in the superior meatus. Beneath the bulla is a semicircular slit called the hiatus semilunaris. Into the hiatus open the remaining paranasal sinuses. The frontal sinus opens through the infundibulum into the anterior end of the hiatus semilunaris. The anterior ethmoidal air cells open nearby in the hiatus, quite frequently directly into the infundibulum of the frontal sinus. The maxillary antrum opens near the posterior end of the hiatus semilunaris. So a tumor that blocks the hiatus of the maxillary sinus would most likely be located in the middle meatus. One last thing to remember about the hiatus of the maxillary sinus is that unfortunately the opening is at the top of the sinus, so that when the sinus contains mucus or pus, it cannot escape into the nose in the erect posture until the sinus fills to the level of the opening. However, it can be drained by postural drainage, that's to say by holding the head back, or surgically by making an opening into the lower part of the nasal cavity.